Being a new parent is fun, adventurous, exciting, but it also brings some challenges. You have your newborn period with a snuggly newborn where you're learning and exploring and watching them develop until the toddler phase, affectionately regarded as the terrible twos and threes, where there tends to be some roller coasters. I'm going to help you on this show navigate through the challenges that we are faced with during the toddler period that we call the terrible twos and threes on this next episode of Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Hi, I'm Dr. Scarlet Constant, founder of Constant Care Pediatrics here in Miami. Today on this episode of Ask the Doc, I'm going to answer your questions in real time regarding the terrible twos and threes, a picky eater, and other challenges that we might face during the toddler period. It looks like we have a question coming in now from the All Health TV app, and the question is from Tammy. Hi, Dr. Constant. I am 6 months pregnant with my first baby and have heard friends tell me over and over that the terrible twos are a real thing and they are challenging times. Can you tell me a little of what I can expect and what I need to do to get ready? Well, Tammy, congratulations, first of all, on your pregnancy. And there's a whole newborn phase that you can look forward to enjoy and learn along the way. The terrible twos are further away than you think. But in the meantime, let's talk about some of the challenges that are posed during this toddler period. Well, first of all, the terrible twos usually begin between 18 to 30 months of age. It's not exactly when the child turns two. So you're looking at maybe the 18-month is when you start to see some of the behaviors develop that reflect what we call the terrible twos. And despite what the name implies, it usually can last into about the third year of life. So what can we do to prepare? Well, I think the best thing for you to do is to keep an open mind because first of all, not every child is the same. And it doesn't necessarily mean that your child will go through the terrible twos. It's just a time where there tends to be some challenges between the parent and the child as far as direction, autonomy, and discipline. And not every child will go through it, but you might expect that your child might give you a little more resistance than you were used to experiencing when your child was an infant or even after the 12-month phase. I would say to keep an open mind and also try to remember that communication is key. The more we communicate with our children, the more they understand what the boundaries are that you have set for them. They understand what your expectations are, and they actually understand what is going on around them. A lot of the reasons for the fighting that happens during the terrible twos period is because the child cannot effectively communicate with their parent and express what might be concerning them or bothering them or even confusing them. Or in turn, they don't truly understand what it is that you expect of them. And so that's where the challenge is, and that's where the friction comes into play between parent and between child, the caregiver and child. So, for example, during the time of the terrible twos, your child is learning to walk for the first time. They are learning how to be a little more independent. They have more opinions than they did before. At 12 months, you just go with the flow. Your parent picks you up, puts you in a car seat, and drives you over to a restaurant. You have no say. You have no idea what's happening. You have no idea where you're going. Whereas by the 18-month period, you can actually walk independently and you don't want to be carried to the car. And why am I going to this car? And why do I need to get into the car seat? So a lot more questions start coming into play. And you parents have to start answering these questions and responding because now this is a child that actually has an opinion or just at least wants to understand what is going on. There are more emotions involved. Now they can actually, express to you that they feel happy about doing what they're going to do, or maybe they don't want to. There's resistance or reluctance or fear, and all of those things come into play. And this is what emotions we start to see unravel during these situations. So some situations that might upset your child Could be that, like I indicated before, they don't have the language skills to really communicate clearly what they want or what they're even asking, right? They might not have the patience to wait their turn or even wait for you to address their needs. They also might not have the hand-eye coordination to execute certain tasks that are expected of them, and that frustrates them because they are emotionally immature, and therefore you see some type of, what we would call a tantrum, but that's really just frustration due to the inability to actually execute what they'd like to execute. So these are things to keep in mind and to understand before your child is that age so that you're ready for it when you start to see it kind of unravel before your eyes. You understand the stages that your child is going through so that you can address them correctly without having a big fight. So I hope that was helpful, but like I said, you're only 6 months pregnant, so let's just focus on the early newborn period now, and we'll slowly over time get to know your child and what type of personality your child has so that you can better address their toddler phase. Okay, so we have a question coming in from Facebook and it's from Nelson. My niece just turned 2, and I see her running the house. She cries and yells, and my sister gives in. Are kids this age as manipulative as it seems? Well, Nelson, the answer to that question is yes and no. Yes, they are manipulative in that they understand the situation. They understand which parent will give in and which won't. They know who they could push, they know who they could press or push the boundaries with, and they understand who they cannot do that with. But they are not truly being manipulative in the way that we are really thinking about it. They're not trying to gain anything from us. They're not trying to truly run the house. What happens is that, these young children need boundaries. They need discipline. They don't know that they need it or want it, but this is what helps them. It's almost just like having too much freedom and too much free reign almost it overstimulates them, and there's just too much happening where you can just run around, say what you want, do what you want, and then the second someone isn't listening, you don't understand why that's happening because typically you get everything you want at every minute, every second, every day. So it's not that this child wants to run the house and run everybody down into the ground. It's just that there is no order and she needs order. And your sister needs to put that order in the house because it's not up to the 2-year-old to suddenly start to fall in line when there's no path or no guidance for her in the home. So I would advise you, if you feel comfortable enough, to talk to your sister about putting some rules in place, trying to set some order in the house, have a schedule, have boundaries, and help her daughter actually kind of get a hold of her emotions and what's happening so that she won't, have these explosive moments in the home or what seems like she's terrorizing everybody in the house. That's not intentional. And so I would say that it's on your sister to try to restore order. Good luck. Okay, it looks like we have a question from the All Health TV app. This is from Alicia. Hi, Dr. C. My daughter turned 2 a few months ago and gets very frustrated these days. She tries to communicate, but gets very mad when I don't know what she's trying to say. Is this typical behavior? And what can I do to figure out what she wants? Well, Alicia, this is typical. At 2, you actually should be speaking, probably putting 2 words together to form a phrase. And the fact that they feel they are speaking and communicating, they expect you to understand what they are saying. So it is a little frustrating when you are not able to actually understand what they're saying. But what I would try to do is simplify what she's saying, simplify the terms a little bit so that we can go step by step to try to understand what she wants. At 2, you can communicate and you should be able to understand at least 50% of what she's saying, and she should certainly be able to understand you. Now, if the child is not understanding you at all and you feel that there is definitely a language delay and she's getting more frustrated than you think is normal for her age, that's a red flag of a delay. And that could be a child that has some form of developmental delay. A lot of times when I see children very frustrated and very upset and unable to communicate and get their point across, especially by an age where they should be able to say things and follow simple orders and follow simple commands, that could be a red flag for developmental delay. And at that point, I would speak to your pediatrician and talk about a proper evaluation. So good luck and I hope that that helps. In case you want to send in your questions, take a look to see how to do it.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome back. It looks like there are a lot of questions rolling in. This next question is coming in from Esther. I babysit my 2.5-year-old grandson while my daughter works, and I get frustrated because I tell him to do something or not to do something, and he doesn't listen. Can he really be expected to follow directions at that age, or are my expectations too high? Esther, your 2.5-year-old grandson can definitely follow instructions and can definitely listen. Your expectations are not too high. I don't know what the expectations are in his home, but at 2.5, he can certainly understand right from wrong. He can understand when you don't want what there's certain things that he should not do. Now, of course, it depends on what you are also requiring of him. Some parents just or grandparents might feel that the child's behavior is annoying or louder than it should be or really disruptive when it is age appropriate behavior. So the question is he age appropriate or not? Is his behavior age appropriate? And if it is age appropriate, then we have to cut him a little bit of slack. But if it isn't, and you do see that he's doing something that he certainly knows better and should not do, then absolutely he is capable of understanding and listening to you and following those directions. And I encourage you to be patient because again, your rules and his parents' rules might not be the same and they might not be in line. So that's something that you also have to take into consideration when you're with him. You have to see what he responds to, what he's used to doing at home and what he isn't used to doing, and then explain to him and really outline your expectations from him. Because if he doesn't understand it, because those are not expectations at home, you can't expect him to suddenly respond to you. So I would say that it's very important you lay out your expectations and try to remain patient. It is very difficult and there is a generational difference between you. And so I would try to, maintain patience and don't get too frustrated because sometimes that can put us in a bad position as well. Okay, so we have another question coming in as an email. This is from Alvin. Hi, Dr. C. I'm concerned about my niece. My sister tries to feed her healthy things, but being a toddler, she carries on until my sister gives in and feeds her less nutritious foods. I'm worried about her development, but my sister says she can't fight with her to eat every day. How would you suggest my sister handle feeding time with my niece? Well, then this is all very difficult, but nobody enjoys the picky eating child. It's very hard to experience as a parent. It's hard to watch as a relative. It's a stressful moment for everybody that's involved. I think what's most important is that your niece is eating, and I would hope that your sister is actually offering maybe not the healthiest choices, but somewhat healthy choices. Offering something that is substantial and that works, and while it might not be greens and hearty vegetables, if it's something that is somewhat healthy, then I think you should let your sister handle it the way it works for her and her family. Obviously, if it's fast food and harmful for her child, I would certainly intervene and maybe give your sister some advice about healthier options. But in the meantime, sometimes it's very difficult with kids that refuse to eat. I would tell her to try to hide veggies if possible, give different options, increase the variety. But again, this is a very specific to each family. I don't know what your sister's work schedule is like and how difficult it is for her, and if getting nutritious food is a barrier for her. So these are things to consider when we see parents feeding in a way that we might not find acceptable. We really need to understand what's going on in the home and if this is their only option. So I would talk to your sister and maybe offer her some advice about healthier choices and really talking about increasing the variety to your niece so that it's not just her way or no way, and maybe helping your sister out a little bit by trying to take your niece over and see if she will eat at your house with maybe your children and see if maybe that's something that like communal eating sometimes works very well, Well, they'll eat with other kids and try new foods with other children as opposed to in their own home. I mean, there are many different ways that we can try to explore, but it's not very easy. So I would cut your sister a little bit of slack. Okay, so we have a question coming in now from Facebook, and it's from Jenny. Thanks for your insight, Dr. C. I too get very frustrated with my son, who is going through terrible twos. My question has to do with disciplining him. I speak firmly to him, but that doesn't work, and I sometimes yell at him, and that doesn't work. What should I be doing differently? Jenny, it gets very frustrating, and the first thing I will say is if you feel that you are getting very upset and frustrated and almost kind of losing control, I would say to stop and give yourself a break. Just walk away and don't engage with him, because sometimes we might end up making decisions that we regret when we're very frustrated and we feel like we've reached our maximum breaking point. So I would say to step away. Sometimes when they're not listening, it's just a challenge. It's just to push you to see how far they really can get. And at that point, I would disengage. I would not engage with him and go back and forth if he's not standing down. You turning around and walking away is not standing down. It's not giving up. It's not letting him win at all. It's you just not even acknowledging his immature behavior. And then you can come back when things are calm and he's not crying or throwing a tantrum and you've calmed down. And then you can discuss what happened and why you are upset or what he did to break the rules and how you would like him to respond differently the next time. I find that that always works for me, is to let the situation just die down, everybody calms down, and then remove from the specific event that happened is when I would discuss what went wrong, how we could have done it differently, and what I expect in the future. And then just leave the previous issue alone. When it gets to a point where you're both battling it head to head, it's just done. There's no point on trying to resolve the issue anymore. So that's my advice to you, but truly take a break and tap out if you feel that you're about to yell or scream or grab him, just walk away. Okay, in case you need to submit any questions, take a look to see how to do it.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome back. So this seems to be a really hot topic. We have a couple more questions coming in right now. Alexis wants to know, I took my 2-year-old to the pediatrician last week, and she mentioned the importance of me setting up boundaries, but I'm not sure what she means. Can you talk a little more about what it means to set boundaries? Absolutely, Alexis. Your child needs to know what is absolutely not acceptable to you and what is acceptable behavior. And those are boundaries. That means that there are certain things that we all grew up in a house where we knew like we could get away with maybe one or two little things, but there were certain things that were a no-go in our family homes, right? And this is the time where you start talking to your child about right from wrong and what they can and cannot do and what your rules are. And you don't necessarily need to threaten or tell them what the repercussions are if they break the rules, but you just need to establish those rules and what you will not allow under any circumstances. They are verbal, they are speaking, they have receptive language, they understand you. And you should absolutely establish that in your home first and foremost, before you start getting upset and punishing. Parents love to say no all the time. The child moves to the left, no. The child moves to the right, no. They pick up something they're not supposed to hold, no. That's not establishing boundaries, that's just saying no. And they get used to it, and after a while, they just don't listen to you anymore. What you want to do is show your child, these are toys that we play with. We play in this room. These are mama's things. We don't touch them. We don't throw them. You can explain to them what the significance is and what you expect out of their behavior. So that's how you set up boundaries. And it is ongoing, trust me, from toddler, adolescence till pretty much young adulthood. This is something that we need to do as parents, because if we don't set up those boundaries, how could we possibly expect to punish them for crossing them if they didn't know that they were there? So that's my advice to you, is to really have a healthy discussion with your child over and over and establish the boundaries within your home and within your family. Okay, so we have a Facebook question coming in now. This is from Adriana. Hi, Dr. C. My question is about my daughter's development. She's 1.5 and is now very active. What are some of the milestones I should be looking for at the 2 to 3 years old? Well, Adriana, at about 2 years of age, like I said, as far as verbal, your child should say two words that they put together to form a phrase. They understand how to follow one and two-step commands. From a motor perspective, they're walking, running, they're going up steps, coming down the steps. They're able to throw a ball, play outside. They parallel play with their friends, meaning they might not interact with them, but they certainly sit beside them and do puzzles and put things together. And they are able to feed themselves and make choices and brush their teeth. And so there's a lot of independence happening between ages 2 and 3. And this is why sometimes we see some of the friction between parent and child, because our little baby has now all of a sudden become very independent and they want to do things by themselves. And they say, no, I want to do it. No, me. And sometimes we find that that might be defiance, but it's not. It's exerting their independence. And it is very important. So these are things to expect in the next coming months. Okay, so we have another question, and that's from Enrique. Our son is 6 months old, and my wife and I are talking about starting to childproof the house. Can you give me some suggestions of what I should be doing to keep my baby safe when he starts to move around? Yes, Enrique, baby proofing or child proofing the house is actually very important, but it depends on how much you want to child proof. Some families tend to say that they want the child to understand what they should and should not touch and respect their home, and others baby proof every single aspect of the house. So I think the most important things are, number one, to cover all the outlets. I think that is very important. No matter what, you just don't want an accident where something goes into the outlet or a finger or anything, a foreign object, and they get zapped. So I think absolutely covering outlets with them. The outlet plugs are very important. I think if you have stairs in your house, especially as your child 15 months or older starts trying to walk up the steps or crawl down the steps, it's always good to have a gate to block the stairs. That's very important. And then we go into all of the other things, just there's like the bumpers around the corners of the coffee table. Some people like that to protect from bumping their head or falling and hitting the corner of a table. I think that's always nice just to have that, because toddlers fall very often, their balance isn't there yet. I think it is very important to make sure you have the cabinet locks, because you certainly don't want a toddler wandering into the kitchen cabinet or medicine cabinet, anything where there are toxic substances or medications. Those are things that you don't want them to accidentally ingest or open up. So the cabinet locks are truly very important, at least the lower cabinets. And of course, it's always important to mention, if you are a gun owner, then it is important to lock away your gun in a safe place, preferably without the ammunition. So you lock the ammunition in one box, the gun in the other box, and you put them in a safe place that's out of reach of any child. That's also, of course, very important once you have a toddler walking around. I think those are the most important things to consider. Everything else, some people put away all of their glassware, they won't have vases out and things like that. And I think that just depends on your family and what your expectations are, and how much you really are concerned about your child, shattering and breaking everything all around. We personally didn't do that in my home. We taught the kids what they could touch and what they couldn't touch. And we left our home exactly the way it was, with glassware and art and flowers and everything, and just taught them not to actually touch it. But I'd say the protective things that protect against falls and accidental trauma are very important to have in place. So it looks like we still have some time for one more question. Let's see, we have a question from Anna. Hi, Dr. Constant. I'm getting so frustrated with my husband. He never follows through with anything he says to our son and always gives in. I'm afraid he's creating a very entitled kid who won't fear consequences as he grows up. How can I get through to my husband? And I'm really sorry to hear that. And it sounds like you and your husband just are not on the same page when it comes to disciplining, or I guess raising a young child. I think the first thing is for the two of you to discuss what you want to come out of this and the type of child that you want to raise, and maybe what his fears are. Maybe he's concerned that his, saying no too much or being too firm might make your son unhappy or traumatize him. So I think getting to the root of the problem first with your husband and talking to him about his ways and why he parents this way and expressing what your concerns are, I think that's the most important thing. So the two of you can get on the same page and then raise your child together the way you both see fit. I hope that that was helpful. And good luck with your toddlers. I know that the toddler phase can be very difficult and daunting, but like I mentioned earlier, if you just stick to the key, which is structure, boundaries, and open lines of communication, then that will help so much more. You don't have to go through the terrible twos and threes. It doesn't have to be a horrible, traumatic experience. If we can just communicate with our children and understand what they want from us and have them understand what we want from them, you really could have a very nice relationship and a peaceful toddler period. Well, I hope that helps, and if you have any other questions, please send them in. We're always happy to hear from you. Have a great day.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.